Welcome back, everyone. New research rejects everything we've been led to believe about daily drinks having a health benefit. Dr. Seale, Regional Director of Clinical Services at the Center for Neuro Skills, is here to discuss this more. Welcome, and thank you for being here. This is a huge study that looked at so many different factors. Can you break it down? Because the World Health Organization backs this. It was in JAMA. I mean, it was serious news that said no amount of alcohol is safe for anybody.
So this was a large systematic review and meta-analysis. It included over almost 5 million people in a number of countries. And so what was found that sort of turned what we thought on its head was some systematic biases were found in previous research. So when we talk about individuals drinking moderately or lightly, enjoying a health benefit, well, who are we comparing that group to?
Right.
So the reference group used in many of the studies included abstainers, but in that abstainer group were individuals who didn't drink because they had a health problem, or individuals who drank for a period of their lives, sometimes heavily, and then stopped. And then a group that the authors called the sick quitters. So these are people who drank until they developed a health problem and then stopped. So this reference group may have been less healthy to begin with.
That makes sense. Okay, so let's talk about the problems here. It talks about it being one of the #1 causes of death, alcohol causing major amounts of death. Obviously, we see so many car crashes every day, but all kinds of diseases. What diseases are now tied to alcohol? We always think of our liver, I think. It goes beyond that.
It does. It does. Digestive or cancers of the digestive system, from the mouth to the throat, stomach, colorectal cancers. Again, death and injury due to brain injuries, strokes, hypertension, a number of diseases that can cause death are associated with alcohol use.
Let's go more into those brain injuries, because that is your specialty. What type of patients are you helping, and how did alcohol play a role in some of the cases?
Okay. So a couple of researchers, John Corrigan and Jennifer Bogner, have done a lot of the research in this area using traumatic brain injury model systems data. And they found that about 66% of people who show up in an emergency room with a traumatic brain injury are under the influence of alcohol.
That's a big number, so the majority of them.
Right, right. Some of their samples were as high as 78%. So there is a significant relationship between alcohol use and traumatic brain injury. Alcohol use is also a risk factor for stroke, because chronic alcohol use can cause hypertension, blood clotting disorders, heart arrhythmias, can lead to diabetes. All these are risk factors for stroke.
The list just goes on and on. Okay, so let's talk about what can be done about it. A lot of people don't realize that low-dose naltrexone is now being used to help people who have the urge to drink, and it just makes that urge go away. Do you ever prescribe that, or what are your thoughts about that?
So I'm not a physician, so I can't prescribe
but
medication.
I'm sorry, I meant through the Neuro Skills clinic.
Right. So naltrexone and acamprosate are one of 3 drugs that are approved by the FDA for alcohol use disorder. And these 2 drugs, naltrexone and acamprosate, actually bind up receptors in the brain. So alcohol does not have the pleasant effects. So it blunts the pleasant effects, the euphoria, relaxation, and also reduces cravings. So people don't feel the benefit of alcohol, and they don't crave alcohol. So it helps people cut down or stop.
Well, I know we're a real buzzkill for people, because just the thought that just a drink a day, which a lot of people enjoy a glass of wine with dinner, could really be harming their health is a wake-up call, and it's hard to hear. Let's talk about what happened during the pandemic. Do you feel like the rates of drinking alcohol shot up, or did you see more patients with problems during that time?
So the rates of alcohol consumption did increase during the pandemic. In fact, in 2020, alcohol use, at the beginning of the pandemic, alcohol use increased by almost 3%, which is the largest single-year jump in 50 years. So alcohol consumption did increase, and there are a couple reasons for this. One is alcohol was more accessible. The first time in my life you could have alcohol delivered to your door, right? And then secondly, people who may use alcohol as a coping mechanism because the pandemic was so disruptive, may have increased their use as a coping technique.
Well, I tell you what, it's just something for people to really think about. It sounds like more than modification is the key in this situation now that this new information has come out. Dr. Seale, thanks for taking time to talk to us from the Center for Neuro Skills. An honor to chat with you.
Thank you. Thank you.
All right.